Describe the distribution of the suboccipital nerve. Muscles of the suboccipital region. Describe the distribution of the greater occipital nerve. The skin over the neck and occipital bone. Describe the distribution of the lesser occipital nerve. Skin of the superior posterolateral neck and scalp posterior to the external ear. Describe the distribution of the posterior rami of the nerves C3-C7. Intrinsic muscles of the back and overlying skin. Name the 5 superficial and intermediate intrinsic muscles of the suboccipital region. 1. Trapezius. 2. SCM. 3. Levatore Scapulae. 4. Spinous capitis. 5. Spinous cervicis. Describe the attachment sites of the spinous capitis muscle. Ligamentum nuchae and the spinous processes of C7-T3 to the occipital bone, superior to the nuchal line, and mastoid process. Describe the attachment sites of the spinous cervicis. Spinous processes of T3-T6 to the transverse processes of C1-C2. What is the innervation of the spinous capitis and cervicis muscles? Posterior rami of C1-C6. What are the actions of the spinous capitis and cervicis muscles? Bilateral equals extend neck and head. Unilateral equals flexes and rotates neck and head to the same side. What muscles of the suboccipital region lie directly underneath the intermediate muscles? 1. Semispinalis capitis. 2. Longissimus cervicis. Describe the attachment sites of the semispinalis capitis muscle. Transverse processes of C4-T7 to the occipital bone, between the nuchal lines. What are the actions of the semispinalis capitis muscle? Both equals extend the cervical spine. 1 equals flex head to the same side and rotate head to the opposite side. Describe the attachment sites of the longissimus cervicis muscle. Transverse processes of C4-T3 to the mastoid process. What are the actions of the longissimus cervicis muscle? Both equals extend the head. 1 equals flex and rotate head to the same side. How many suboccipital muscles are there? 4. Name the suboccipital muscles. 1. Rectus capitis posterior major. 2. Rectus capitis posterior minor. 3. Obliquus capitis superior. 4. Obliquus capitis inferior. Describe the attachment sites of the rectus capitis posterior major. C2 spinous process to the inferior nuchal line. Describe the attachment sites of the rectus capitis posterior minor. C1 posterior tubercle to the inferior nuchal line. Describe the actions of the rectus capitis posterior major and minor. Both equals extend the head. 1 equals rotate head to the same side. What nerve innervates the rectus capitis posterior major and minor? Suboccipital nerve posterior rami C1. Describe the attachment sites of the Obliquus capitis superior. C1 transverse process to the occipital bone, above the inferior nuchal line. Describe the actions of the Obliquus capitis superior. Both equals extend the head. 1 equals flex, same side, and rotate, opposite side, head. Describe the attachment sites of the Obliquus capitis inferior. C2 Spinous process to the C1 transverse process. Describe the actions of the Obliquus capitis inferior. Both equals extend the head. 1 equals rotate the head to the same side. What nerve innervates the Obliquus capitis superior and inferior? Suboccpital nerve posterior rami C1. What artery does the occipital artery branch from? External carotid. What artery does the vertebral artery branch from? Subclavian. Arises through the transverse foramen of the cervical vertebrae. How do the vertebral arteries reach the brain? Cross the superior surface of C1 and enter the foramen magnum. What does the union of the vertebral arteries form? The basilar artery which joins the Circle of Willis to supply the brain. Describe the pathway of blood through the occipital vein. Occipital vein greater than deep cervical vein greater than vertebral vein greater than brachiocephalic vein. How is the vertebral vein formed? Several small veins of the internal vertebral plexus unite and head through the transverse foramen of the atlas. Where does the vertebral vein terminate? At the C6 vein, where it leaves the transverse foramen to join the brachiocephalic vein. What type of joint exists between the atlas and the occipital bone? Condyloid synovial joint. What action happens at the atlanto-occipital joint? Nodding, yes, movement. What type of joint exists between the atlas and axis? Synovial pivot joint. What action happens at the atlantoaxial joint? Shaking head, no. What ligaments are crucial in the stability of the atlas and the occipital bone? 1. Alar ligament. 2. Cruciate ligament. What bony projection on the axis allows for the formation of a pivot joint? The articulation of dens.